So many women have not been well served by our healthcare system. We really need advocates. The person who is my special guest today has been a patient advocate for many years. She is a real pioneer for women's healthcare. She is somebody who I greatly admire and was honored to have her as a guest on the podcast. Let me tell you about this trailblazer, Dr. Erika Schwartz. She's the founder of Evolved Science, a world-renowned medical practice based in New York City, built on the recognition that bioidentical hormones are the foundation for better health. Once hormones are balanced, the practice focuses on optimization and longevity through disease prevention, patient advocacy, and coordination of care. Dr. Erika is a pioneer in the use of bioidentical hormones for preventing illness and recognizing their direct link to overall wellness and their interconnection with diet, sleep, and stress management. Her focus on treating patients as a whole person began more than 30 years ago with her understanding that bioidentical hormone replacement is the safest and most effective path to increased health span and to achieve the highest quality of life. Dr. Erika has authored 8 best-selling books, as well as numerous articles in publications such as the New York Times, the Wall Street Journal, Daily Mail, Vogue, Town and Country, and the New York Post. She appears frequently on TV shows, international podcasts, and in social media. She's a distinguished faculty member of A4M, the world's preeminent longevity and functional medicine organization, where she hosts the popular Redefining Medicine podcast. Dr. Erika continues to spread her message worldwide with the goal of changing healthcare to benefit the patient and eliminate fear from the healthcare system. Dr. Erika sees patients from all over the world and believes that when given the correct information, patients can take charge and improve their own healthcare outcomes. I know you are going to enjoy my conversation with Dr. Erika. Dr. Erika Schwartz, thank you for being with us today.
Thank you, Dr. Sandi. It's so nice to be with you.
Thank you. So, you and I go way, way back in healthcare. I think we have seen it all. And what I want to get into you is how you came to write a book titled Don't Let Your Doctor Kill You. And I love the title. And I was wondering if we could start there. So
Sure.
How can we have many health coaches who are listening, people who are thinking of becoming health coaches or who are just fed up and want to take charge of their health. And so how can we take steps to really be empowered to take charge of our health when it comes to working in the medical community?
Yeah, it's a nightmare. Actually, we've been talking about healthcare being a mess and being broken for decades, and we've done nothing about it. And, we've blamed the insurance companies, we've blamed malpractice, we've blamed everything, but we have never sat and figured out how to improve it. And I'm all about making things better. And my idea of Don't Let Your Doctor Kill You, because I'm a doctor, so I can talk about doctors. I have an MD after my name, so I'm fully trained in a conventional system. I started out by running a major trauma center. I'm an internist and emergency room trained, critical care doctor. So I've been around for a long time, as you know. And I have watched the system fail from the medical profession's end. Mm-hmm. And in the 1990s, which is long before many of our audience were born, what happened was that I saw that there had to be a change, because if there wasn't a change in the way doctors treated patients would become scared, intimidated, by the fact that it used to be like white coat syndrome, right? Because you have high blood pressure when you go to the doctor's office. So they would be intimidated, they'd be scared, and then they couldn't hear what the doctor had to say, and they do whatever the doctor wanted, which is exactly what the pharmaceutical industry and the, surgeries and the, testing and everything else we're doing wants is for you to be scared. And then if you're scared, you're going to do everything. So I thought, well, and I was doing a review, actually. I was reading, this is in the late 90s. I was reading, and there was a doctor at Johns Hopkins who had been, I can't think of his name off the bat, but I'm sure we can figure it out. Anyway, who had done all the research on what was the underlying cause for medical errors. And the underlying cause keeps on coming back over and over again as being medical mistakes, medical errors. Medical errors come from physician arrogance, right? And this doctor, and this is at Johns Hopkins, it wasn't some backwoods, small country hospital that, you be an outlier. It's exactly the middle, the center of academic medicine. He said it's physician arrogance. Everything stems from physician arrogance. And then I went back to education. And at the time, I was on the board of Downstate, the medical school I attended. I was conventionally really ensconced in the conventional system. And every time I looked around, I realized that the senior attendings, everybody who was at the top of the ladder was arrogant. And it was arrogance that created exactly what the sky had said. So then I started paying attention to my patients coming in, and everyone had a horror story from the medical system, from the healthcare system. Every one of them was afraid of their doctor. And I would say, well, why are you afraid of your doctor? He doesn't live in your body, and she doesn't live in your body. You live in your body. You know better what's going on. They're there to just give you recommendations. You can take it or leave it. It doesn't matter. And as time went on, one day I just woke up and I said, well, this is Don't Let Your Doctor Kill You. I have to. I mean, it was like my 5th or 6th or 7th book at this point. And I said, I have to write this book. The first time I went and I told my editor about the book, they said to me, nobody really knows who you are. Don't do it. It's going to ruin your career. It sounds really horrible. So I turned around and I wrote 3 other books about hormones, about menopause, and it was still before anybody knew anything about it. And then I went back, and about 8 years ago, my publisher said, oh my God, I love the idea of the book. Let's do it. So I did it, and it did very nicely. My publisher and my PR person that you spoke to, actually said to me, you need to re-release it. After COVID, things went very, very wrong.
Sure.
They went in the wrong direction, and they're going even more every day. And it's become, horrible, just the concept of going into a hospital, just the concept of seeing a doctor. And it's like, because of what you're doing is teaching people how to coach people, to help them, to protect them. And I've always been a patient advocate. So it's not like this is news to me. It's always been something I cared about because I've never thought of myself as being more important than the patient. I've never thought of myself as being something special because I have an MD after my name. As I've said many a time, I used to tell people that I wasn't a doctor at the beginning because I'm a healer. And I didn't want people to think of me as a doctor. And they still do. Now I use being a doctor to tell people my experience and get the credibility and be able to write a book like Don't Let Your Doctor Kill You and not be laughed at and say, oh, here's some other person bad-mouthing the system. I'm not bad-mouthing the system. I'm just telling true stories. And I brought COVID into this new edition, and I also brought the AI situation in it. And it's about helping people, empowering people to take their own health in their own hands. Because you're better off with no health care than with bad health care. And if you're intimidated, if you're treated arrogantly, if you're not treated by somebody who cares about you, you're at risk. And I wouldn't take that lightly. And I know it because I've been doing this for 40 plus years. So that's how I came up with Don't Let Your Doctor Kill You in a very long, roundabout way.
That is so true about becoming empowered. And study after study of health coaching shows self-efficacy is what increases. And the sense that you can take charge of your destiny. It's not all in your genes, or you don't have to blindly follow what the doctor says. And we also know that when people see health coaches, they're much more honest. They'll tell that person things that they're afraid. They still see the doctor as that authority figure. And I think perhaps nowhere is this worse than for women's health. And you have been a pioneer in women's health. You were one of the first to talk about bioidentical hormones, and who was in that generation that was doomed because we had the women's health study, we were misled. And I remember so many doctors that say, well, I don't know anything, or I don't know about hormones, or just thinking that this is something that we all need to stay away from. And so this is something, what do you see? Are there any signs that it is getting better with the younger doctors? Are they wanting training in, for example, bioidentical hormones? Is this something they're interested in, or is it still pretty much the same?
Well, like everything else, people come to me because they want hormones, right? And they want to, 360-degree care, and they want somebody who can hold their hand and cares, right? So I'll see the pre-selected group. And I also, as you know, I'm faculty at A4M. And so obviously we see those who see the light, who want training, because we have bioidentical hormone training tracks, we have peptide tracks, we have a lot of really serious growth potential for doctors and for healthcare professionals. So yeah, from where I sit, I see an enormous improvement and growth. And, we have almost 20,000 members at A4M. And in December, when we have the Longevity Fest in Vegas, it's going to be like, I don't know, the biggest it's ever been. So it's wonderful. So from where I sit, there's a lot of improvement, and there's a lot of growth, and there's a lot of potential. And, I don't feel like I'm screaming in the dark alone anymore, like I did for 20 plus years, for like 25 plus years. I feel like there's a lot of support. But at the same token, the medical education is not changing. It has the same attitude. They have not done anything to improve the doctor's relationships with patients, the doctor's behavior. There's no course that teaches them how to behave, that teaches them that they're dealing with humans. There is no such thing. The same way there was no nutrition course in medical school when I went to school 50 years ago, there's no how do you behave towards a human being. It's just that society has changed. And I think it's like everything else, society is pushing the change. And I think that we're going to see more and more change as we move. And we'll see for how long we'll be around to watch it. But it's great to see because I'm not alone anymore. So
Yes.
I could tell you that in 2008, I was talking to the head of OBGYN at Harvard, and I was saying to him, please, we need a women's health specialty. And he said to me, well, we are women's health specialty. And I said, no, you're not. You only are the ones who deliver the babies and take out the uteruses. That's it. You don't do anything. And he said, how could you say that to me? And, and they invited me to give a talk because I had written the book about hormones at the time. And he never heard anything. And, I haven't spoken to him in a long time. He's a really nice guy. He's now retired, but he's still the editor-in-chief of Menopause, which is the mainstream American College of Obstetrics and Gynecology journal. And I think I should call him, really. I've been thinking of calling him and sending him saying, hey, how are we doing in the women's health? Because 2 years ago, with A4M, we started the Women's Health Summit. And the Women's Health Summit has grown the first year, there were like 200 people. You were last time there when it was in Scottsdale in October. And there were like 600 people. And it was capped at 600, at 500 because the facility didn't take room. And the 600 that were there was standing room only, you saw. So things are moving in the right direction. And now I feel like I need to lobby not just to help people, women and men. I don't care. Men need help too. Anyway, but to help women get support and be empowered and stop living in fear of the doctor. But I also think that we can start the women's health as a specialty. And that could be, because we have so many names for what we do: functional medicine, alternative medicine, complementary medicine, longevity medicine, anti-aging medicine. I call it prevention. I've been calling it prevention for the past 30 years, and I'm not going to change it because prevention to me explains exactly what it is. But women's health is prevention. And that's what I think is really important. And I think as we grow, you're going to see me hopefully next year at the same place doing the same thing, educating and bringing people up to date on what we know. And we have great people. A4M is very, very supportive of everything we do. So we're lucky.
Yes.
We found a home. We found a home.
Yes, I love A4M. I will be there at the longevity and the next women's health. And we are committed to training our health coaches to be the support. Because I got to tell you, I just think that there's so much that is lacking. My daughter, who is 41, she was talking to her friends the same age. And one by one, they were all saying, well, I've just been feeling out of sorts and I'm irritable and I have brain fog. And I went to my doctor and now I'm on an antidepressant. And she came back, she said, well, I would ask, did they talk to you about hormones? Did they do any testing? Did they talk to you about stress and sleep and exercising? Many of these women are in Orange Theory, they're burning themselves out and then they're not sleeping well and they're stressed and they're not eating well, they're intermittent fasting and there's so many issues that, but no, the doctor just wrote me a prescription. Didn't have time, even if they wanted to. They don't have time often to spend.
No, don't cut them so much slack. Do not cut slack. Because you know what?
Yeah.
I'm a doctor, remember. I have training. I actually have training from 50 years ago, but unfortunately, it's the same.
It is.
You know what? It's up to them, each one of them, to learn, to stay up to date. They don't stay up to date. They finish their training and they get into, whether it's because of the insurance or whatever, they don't make money. It's crazy. But unfortunately, all the reasons are environmental. They're not about the patient. So if you go to a doctor and the doctor doesn't pay attention to you, Sandi, me, Erika, if we don't get attention and they don't notice you, but they think you're a 70-something-year-old woman or a 40-year-old woman, and that's the bucket you fall into, you've fallen and you're better off with nothing. You're better off walking out and saying, thank you so much. I'm going to look for somebody who's going to notice me. It's not any different than any other relationship. I mean, I hope nobody stays in a marriage where the partner is not supportive, caring, loving, notices them. By now, you see it on Instagram everywhere, right? Yeah. Don't stay in toxic relationships. Why would you stay in a toxic relationship with a doctor who's there to only take money from you and not notice you? And it's not like doctors make a lot of money. Some of them do, but most of them don't. They're like just losers because they don't care. And I think when somebody doesn't care, you better run as far from them as possible.
I could not agree more. And the last time, I can't remember, the last time I was at a conventional doctor, I think I was 60, 65, and they were asking me, they only wanted to know if I had my shingles vaccine and a grab bar. And
where's your statin? You're statin.
Yeah. I do handstands every single day. I'm 75. So I don't want to go to a doctor because they're just going to be talking to me about a graph bar in my bathroom when I'm ready for the assisted living. So, but that's so sweet. But it is really that there's so many ways that you can take charge of your health. And I'm particularly concerned. I'm seeing it in generation of women in particular, men as well, but people in their 70s. I do strength training many times a week, and I'm learning to lift heavy things.
But you look great.
Thank you, and
You
you
look
look
great.
well.
We're the same age, so we
I
know.
we
Yeah.
know what it's like. But
But it's like, you know what? You don't want to be superfluous. You don't want to become unnecessary. And in the conventional medical world, you become unnecessary and you become disposable. And that's how we age. And that's how they miss out on the wisdom that we've accumulated that we can share with the young people. And it's crucial. And I think it's kind of a really bad situation that is created purely to provide money for people who don't care. I mean, how do you give, like you said, that woman, how does that woman get antidepressants? Antidepressants are the number one sellers in the United States. And they're given to women. They're not given to men. Most women are on antidepressants. Why are you giving women antidepressants? They're not missing antidepressants. What they're missing is hormones.
Yes.
So why don't you put them on hormones first? And why don't you teach them they need to sleep? They need to learn their bodies. Women don't know their bodies. It's horrible. Doctors don't know women's bodies. They don't care. They'll just throw the medication at you. Physical examination is pretty much obsolete.
Right.
It's really crazy. The thing is, you don't have to put up with that. You don't have to be adversarial. You don't have to be negative. You don't have to be mean. Just walk out. Just say, I'm here. You notice me? Fine. And then go talk to your coaches.
I love it. Absolutely. Because we can take charge of our health, and it's getting easier and easier. We've got direct-to-consumer labs. I tell people all the time, they're saying, well, I wonder what my vitamin D level is. I said, well, you can go to Quest Labs. You can get that test. You can find out. You don't have to wait if your doctor says, oh, you're good. You don't need that.
Yeah, you know what, Sandy, that's really something else. And there are a lot of stories, and they're all the stories, and don't let your doctor kill you, are stories from my practice, from my patients. So I listen to it all day because I still see patients 3 days a week. But you know what? It's really sad to see how women accept this. And it's so easy to just break the pattern and move on and say, I don't care. I tell the story, and I just told it the other day. We had this big book launch in the city for the book. And I was talking about this woman, patient of mine, who had gone in to the gynecologist. And this guy happened to be an oncological gynecologist. So obviously all he saw was cancer. And she had an ovarian cyst, and she was 60 years old or 50-year-old. And he immediately said, there's a 6% chance you have cancer. And that's it. When somebody said that, she couldn't hear anything else. So she came running to me, and she didn't come. She called me, actually. And she said, he said I have a 6% chance of having ovarian cancer. So I'm going to go have an oophorectomy. So I said, wait, breathe. First of all, let's breathe. Don't do anything. Think. What does 6% chance of having ovarian cancer mean? And this woman was like an executive for one of the top, for JP Morgan, right? So she says, what does it mean? So I said, doesn't it mean 94% chance of not having ovarian cancer? She said, I can't afford 1% chance. So think how brainwashed, fear-mongered this person is. So anyway, she went on, she had her ovaries removed. Fortunately, I was there to take care of her hormones. But the thing is, it's horrible. Just think about it. For you to buy in when somebody, by the way, she didn't have ovarian cancer, obviously. But for you to tell a patient, you as a provider, to tell a patient something that disturbing, such a horrible perspective, and to know that you're not telling anybody what their absolute risk is. Each piece of information you're getting from any medical journal, from any doctor, that is a percent likelihood of getting something is a relative percent, because we don't know what the absolute risk is, because we don't know what your risk or my risk is, because we don't know. We're not going to know until it's over, right? Until something happens. So why don't you tell the truth? Stop bullshitting. Stop lying. Stop intimidating. Start empowering. Start helping people enjoy their lives. Don't make people's lives miserable. Make them a little better, because everybody's life is tough enough anyway.
So beautifully said. Oh my God, we can trade stories forever because there's so many similar examples. And I said to just stay in the moment, tune into your breath, feel warmth flowing through your heart. Imagine this organ, imagine blood, imagine healing and psychoneuroimmunology and the work that I used to do. And people were just so scared, but you start to look at these real basic things. And you're anti-inflammatory now. You're creating a different state in your body. Your cells respond. This has been good.
I was going to say, and I remember when I first got involved and I said, there was nobody else doing any of this, right? So I was reading about, Asian medicine, your Chinese medicine, etc. And they knew it all along. I mean, and they were doing it for thousands and thousands of years. And anytime I brought any of it to my colleagues in the conventional world, they looked at me like I had three heads. I remember talking to patients about acupuncture, and 25 years ago, they were like, "What? What's that? Why are you doing that?" Well, guess what? It's time to wake up, and it's time to take control and look at who's sitting across the table from you. And they shouldn't be sitting across the table.
That's true. Now, that reminds me of years ago, this was the late 80s, a top cardiologist, and his younger partners were referring patients to me, but he never had. So I went to see him, and I'm telling him about the work, and patients are getting better with breathing and imagery and all kinds of other relaxation techniques and stress management. And he stands up and he says, "Do you see this journal, this JAMA journal? The day that there's a controlled study in here about this crazy breathing that you're talking about, then I'll see you. Now get out of my office. Shame on you." And fast forward, there's hundreds of studies.
What did you say to him?
Studies. So
what did you say to that guy?
Yeah. So I said, well, it sounds like we're very far apart. I just know I have, so many stories that I could share of people who have felt better. They've been able to lower their blood pressure, get off medication, stop panic attacks, deal with whatever medical situation is going on with them. The power of the mind to really transform. What's real in the mind is real in the body, and but sometimes you just have to let go. And now, but all these youngers,
maybe we don't. Maybe we start going on the attack. Maybe we stop being so flexible and malleable and allowing them to ask idiotic questions, but rather ask them.
And what happens
power the patient. That's what you're doing with the coach.
Power the patient.
Empower the patient.
That's what happens. And they go to the doctor and they say, "Hey, I want to work with a health coach," or, "Hey, I want to do, there must be something else. What else can you offer me? I'm not satisfied with this." Becoming empowered. It is so, so important.
Right. And you know what? If they don't have anything to offer, leave them. Leave them.
Yeah. And many doctors come to it because they themselves. So I would have cardiologists from that practice, their colleagues, they had an MI, they had an incident, and their doctor referred them to me for biofeedback and relaxation work and anger management and what. So
can you imagine how angry they all are?
Well, this has been fabulous. The book, again, is Don't Let Your Doctor Kill You. You can hold it up. It is available wherever books are sold. And we will find it there. And where can people find you? Because I know they're going to want to know more.
On Instagram, DRERIKA Schwartz, SCHWARTZ. Or ES Health, which is the practice that I work at, who I founded many years ago. It's a concierge medical practice. We have a lot of very happy patients. And interestingly, we have patients who've been there for 30 years with me.
Wonderful. Well, follow her on Instagram, get the book. You are a real, you are in this space as one of the pioneers, and I applaud you and love your work. Thank you so much.
Thank you. Thank you.
Bye now.
Bye.